So yesterday, Gauteng Premier David Makhura said he was considering stricter measures to help curb the COVID-19 spread in the province. But the South African Medical Association seems to believe that that's a little too late. Let's speak to Dr. Mark Human from the Gauteng branch about their thoughts on this one. Thank you so much, Mr. Human, for your time. So the Gauteng Command Council is considering whether we shouldn't be moving to higher levels of lockdown. They're meeting today. They want to tighten up some restrictions. Is it really a little too late?
That's a slightly loaded question. I must be honest. There are obviously upsides and downsides to any kind of lockdown. And I think the problem with the thinking about hard lockdowns is it's extremely one-dimensional. It speaks to literally taking care of one problem while a whole bunch of other problems are created in their wake. And we saw that catastrophically with our first level 5 and even to a degree level 4 lockdown. So I think that lockdown on its own is the kinds of lockdowns we've been exposed to are not necessarily the right answers. People spread this disease one to another. And so what you really need to curb is people grouping together, especially in large groups. That's the one single biggest target that should be focused on. Large gatherings of people together. And obviously, unfortunately, when you add alcohol, that usually means that social distancing and all the usual precautions go out the window at the same time.
Yeah.
So it's quite difficult to understand that the bottle stores open. That makes absolutely zero sense if you think about it.
What happened to the plan that the president announced last year, Dr. Human, for districts and provinces to be moved to different levels of lockdown depending on their rates of infections? Has that ever even been implemented?
Not to the best of my knowledge, no, it hasn't been implemented. And certainly it makes sense to titrate what you are doing at a prevention level against the numbers. And we've been tracking rising numbers in Gauteng for probably over 3 weeks now. I think that there are a number of problems here. The information is not distributed to the public in a manner that they can understand efficiently. People got very complacent, and that's where the entire problem has come from. Yet if we were publishing as a Gauteng province, not our national numbers, because our national numbers still hover around the 7-day rolling average of 20 cases per day per 100,000 population, which is not disastrous. But Gauteng has been up at close to 300 cases, which is massively out of, that's a huge cause for concern. Probably anything over 100 would indicate that you need to start warning people to really be careful. So I think a lot of it is information not being sent out to people in a manner that they can digest, because everyone looks at all the numbers that the government publishes every day, and they are like the total number of COVID cases. It's really irrelevant at this point in time. The total number of tests done was always a farce. These numbers mean nothing. But telling us what our current infection rates are, this is very important. People are not stupid. They understand this stuff. Look, we'll find out after the Command Council if Gauteng will be moving to different levels of restrictions compared to other provinces. I've actually just been reminded by the producer that Port Elizabeth, Gqeberha, once went into a different level of lockdown restrictions than the rest of the country. So the province, let's talk about what the province can do then. Because the Gauteng Premier yesterday said they haven't really seen the results for level 3 restrictions. So what can government actually do, apart from calling on people to be extra cautious? What can they do on their side at this stage? I think the one thing you really need to do is clamp down on social gatherings of any kind. Is there any reason whatsoever to have more than 10 people together? That's the first thing. The second thing is to say that where people are able to work from home, it should be mandatory, no longer optional. That already takes a lot of people out of workplaces and puts them safely in their own home. So I think that those are two middle ground measures that would be highly effective. There, of course, and I heard a little bit earlier on your show, there's been talk about closing schools, but most of the studies with COVID have shown that children get COVID from their parents and not necessarily the other way around. It's quite different modes of spread to traditional influenza, where they are usually the biggest vectors.
Thank you for making time, Dr. Human. I really appreciate it. Dr. Mark Human is with the South African Medical Association.